Now we are going to learn a very excellent and wonderful treatment method, that is master tongue acupuncture. One of the best acupuncture for pain management. And we can create the results on the table, on the one sitting, and sometimes we also take many sittings. But if we want to create rapport among patients, then master tongue, one of the best system, because we can create the results immediately, sometime in 6 seconds. So master tongue acupuncture, not only for on management, but it is also working for any problem, for multiple problems in the root. But whenever any patients coming to your clinic with pain, lower back pain, knee pain, headache, migraine, so your first responsibility to reduce the pain. You cannot tell the patients, okay, I am working on the root, so your headache will go after 1 week. No, you cannot tell the patients that till the 1 week you have to be in the headache, you have to be in the migraine. Then slowly, slowly you will feel good. We cannot do like that. If someone is coming with lots of pain, so our first responsibility to reduce the pain. Then patient will tell you, doctor, I'm feeling better. And the heart of patient will tell, heart. The patient heart will tell you, doctor, now I have believed in you. Now whatever you want, you can do. So our first responsibility is to create a rapport, bring the confidence in the patient that you are a right doctor, you are a right healer, and patient has come on the right place. So master tongue acupuncture is the method who will bring confidence in you as well as in your patient because of very faster pain management. Not only pain management, like many problems like polycystic ovary, PCOS, we have seen within 6 sittings, they get disappeared completely. And many times we have to take more time also. That I am not telling you every time we are creating the results in 1, 2, or 3 or 4 days. Sometime, as per the condition, we are also taking little more time. But this is the fastest method among all systems. Because when we talk about the TCM is very excellent, no doubt. TCM is 2,500 years old science, very old science, traditional science. And with the help of TCM, we can become a diagnostic master. We can diagnose the patients very fast. But when we talk about the results, the speed of results, we cannot compare any other system with the master tongue. The master tongue is highest speedy system. And the one more beautiful thing is we can create the results with only few needles, sometimes 2 needles, sometimes 6 needles, sometimes 4. Even we can choose the acupressure. If we don't want to insert the needle, it will create the results. So we will discuss all the things that how to stimulate the point with a needle or acupuncture method, and even without needle with the acupressure method and with other techniques. Because many person has requested me that they also want to learn that how to stimulate the point without needle. So definitely that we also discuss. So let's proceed now. And one more thing to all the participants, if you have time, then join both the lecture, English as well as Hindi, because repetition will make you learn deeply. But if you don't have much time, then you can join anyone as per your availability of time. So now we are proceeding. When we talk about the master tongue, the question comes, if master tongue is very effective, if master tongue is too effective, then why this master tongue has appeared in this world just 40-50 years ago? 1 minute. Let me connect. So now you can see this white screen, and if you find any difficulty, so you can put in the chat box. But if you don't find any difficulty, then avoid putting anything in the chat box because it might disturb others, because messages flashing on the screen again and again. So Master Tung is a great acupuncture scientist, basically from China. He was working in the army and he was not having any medical degree. So he was not having any medical license to practice. And he received this knowledge from the family tradition. He learned from the father, from his father, his father learned from his father in that way. So he learned the system traditionally. And these families were not sharing the knowledge to anyone. And Master Tung was the first person who revealed the science among world. So that's why we tell it Master Tung acupuncture. This science is also very old, like a TCM. But just few years ago, like 40-50 years ago, near about 1973, it comes in the light. So we are telling it Master Tung acupuncture. So Master Tung was working in the army and he has been appointed in the Taiwan. So and after the retirement, he practiced in Taiwan. He was treating lots of patients every day, and he used to put just 2 needles, 3 needles, that's it, to create any results. The Master Tung used to walk, put the needle quietly, calmly, without speaking any sentence, without telling the history, why putting this point, and the observer, the students who was learning under the master tomb, just observing the points. Master tomb always told to everyone, never follow me, never follow the point, just learn the system and follow your own intuition. Because this system is not like that Li11 is, that triple worm or 6 is good for constipation. No fixed system, nothing like that. This system based on science. So Master Tung has created three patterns to search any points. If patient tell, I am suffering with the knee pain, so there were three patterns to search any points. Why Master Tung? So let's discuss pattern number one. The pattern number one was search the point as per image correspondence. Search the point as per image correspondence. What is the meaning of this? What? What is image correspondence? The meaning of this is like this is the mirror and you are standing in front of the mirror. Then tell me, what will you see in the mirror? You will see one another person in the mirror. That's you only. So you will see here one person that is exactly you. So this is called the thing who looks like same. So this is called image correspondence. So as per image correspondence, the thing who look like same can treat each other. So as per this system, if we see the human body, so this is the human body. If we see the human body, the right arm look like the left arm. So problem in the right arm, we can treat by the left arm. This is called image correspondence. If someone is suffering with the problem in the right shoulder pain, so right shoulder pain, we can treat left shoulder because left shoulder looking like right. someone is suffering with the problem of tennis elbow or pain in the elbow, right side, we can treat other side elbow. If someone is suffering with the pain in the right wrist, we can treat the left wrist. So in this way, as per the image correspondence. So this is the right arm, and this is the left arm. So right arm and left arm. So if anyone is suffering with the problem here, we can tell it 1. So we can treat here. This is also 1. So the meaning of 1 is shoulder joint. If someone is suffering with a problem here in this part, this is upper arm, and this is also upper arm. So we can give the number 2. So problem in the 2 can be treated by the 2. So shoulder can be treated by the shoulder joint. Upper arm can be treated by the other side, upper arm. Now, elbow we can give the number 3, and other elbow also we can give the number 3. So the 3 number, one side elbow can be treated by the other side elbow. So right shoulder can be treated by the left shoulder. Right upper arm can be treated by the left upper arm. Right elbow can be treated by left elbow. Now this is the lower arm. So lower arm can treat the lower arm. So 4 number. Lower arm of the right side can treat the lower arm of the left side. And finally, this is the palm and finger, 5 number. So 5 number means right side palm and fingers can be treated by left side palm and fingers. So this is called image correspondence. The first formula, the first sentence of the master tongue: if someone is deceased, someone is weak, then do not touch that weak part. Do not touch the deceased part, and treat as per image on the other side. So one person having right elbow pain, and we are not going to touch right elbow. Instead of that, we will go on the left arm and we will treat the left elbow. So this is the sentence of Master Tung. So Master Tung told, never treat sick area or deceased area. Go as per image. Go as per image and treat that area. This is the sentence of Master Tung. So it's very easy. The treating the right elbow. If you want to treat the right elbow, you can go on the other side. So let's see once again. So we can divide whole arm in 5 equal parts. Point number 1 is shoulder. Point number 2 is upper arm. And joint, the middle joint or elbow, that is the number 3. Then point number 4 is lower arm. And the point number 5 is palm and fingers. So we have divided in 5 equal parts. In the same way, if we are going in the legs, the legs also can be divided in 5 equal parts. The part number 1 is hip joint. That is the part number 1. The part number 2 is thigh, or we can tell upper leg or thigh region, or we can tell it upper leg. That is the part number 2. The knee joint can be given the number 3 because it is the center one. The lower leg can be given the number 4. And finally, the foot area, foot and toes, can be given the number 5. So what is the meaning of that? If someone is suffering with a right hip pain, we can treat by the left and vice versa. Someone is suffering with the right thigh pain, we can treat with the other side. Someone is suffering with the knee pain in the right side, 3 number. And we will not touch the right knee. Instead of that, we will touch other side knee, left knee, and we can treat it. The lower leg can be treated by the other side, lower leg. And foot and toes area, 5 number, can be treated by other side. So in this way, the image correspondence is also applicable in the leg area. So right hip can treat the left hip. Right upper leg or thigh area can treat the left upper leg or thigh area. If pain in the right knee, maybe osteoarthritis of the knee, can be treated by left knee. Pain in the right lower legs or calf muscles can be treated by left lower leg or calf muscles. And finally, pain of the foot and toes on the right side can be treated by pain in the foot and toes on the left side. So this is called image correspondence. Slowly, we will move to the exact point and we will hit the exact point, a specific point. We will target the, like a Arjun is targeting the eyes of fish. So we will target the points finally. And we will rectify the problem. So this is the first step, how we are going and searching the image. Now, we can also do the cross. What is the meaning of cross? So let's see the cross image. The meaning of cross image is if this is the arm, and this is the leg, so this is the number one, or we are telling it shoulder region. This is the number two, and we are telling it upper arm. This is the number three, and we are giving the name elbow. This is the number four, and we are telling it low arm. And this is the five number, and we are telling it palm and fingers. That we know, we already did the classification, and we have divided whole arm in the five parts. Now let's see in the legs. So this was the arm. Now we are looking in the legs. So this is the number one, or we can tell it hip. The number two, or this is the thigh region. Number three, or we can consider it as a knee joint. Now this is the four, and this can be considered as a lower leg. And finally, this is the five number, which is called foot and toes. Now, if we do the cross imagination, as per the cross imagination, now shoulder can treat the hip and hip can treat the shoulder. Now, if someone is having frozen shoulder problem and unable to move the shoulder, having restricted movement in the shoulder, without touching the shoulder joint, you can work on this. Without touching the shoulder joint, just going on the hip region. As per the cross image, it will work because arm and legs both are looking like same. Arm is having three joints, shoulder joint, elbow joint, and wrist joint in the same way. Legs is also having three joints, hip, knee, and ankle. Both are looking like same, like a mirror. Like you see yourself in a mirror. So arm looking like legs. So shoulder can treat the hip and hip can treat the shoulder. Upper arm can treat the thigh and thigh can treat the upper arm. So if someone is having shoulder pain and pain is also referring down to the upper arm, we can do, we can put the point in the thigh. It is not mandatory to put the needle. Even massage of the thigh will work for upper arm. And the most wonderful thing is here. Elbow can treat the knee and knee can treat the elbow. And we are having so excellent point in the master tongue acupuncture for the knee pain. Person is coming to you with a complaint of knee pain. And as soon as you put the needle in the elbow, pain disappeared within 6 seconds or less than. Immediately, like switching the switch and light is starting. In the same way, putting the points and pain is disappearing. So for the elbow, we can go in the knee, and for the knee, we can go in the elbow. Nowadays, we know there are lots of patients suffering with the knee pain. So we are having frequent treatment on the elbow joints. Now, if we are going to the low arm, it can treat the lower leg. Even if we go in the palm and fingers. So foot and toes looking like palm and fingers. So pain in the fingers, we can treat in the foot, even foot drop. Numbness of the finger can be treated with the toes, and numbness of the toes can be treated with the fingers. You do something in the fingers and palm, it will directly work on the foot as per image correspondence. So as per this concept, shoulder can treat the hip, upper arm can treat the upper leg, elbow joint can treat the knee joint, the lower arm can treat the lower leg, and finally, if any problem happening in the palm and finger, trigger finger, numbness of the finger, pain in the finger, pain in the palm, so 5 number can treat the 5 number. So this is called image correspondence. So first we have learned the image correspondence, arm to arm. So one arm can treat the other arm. Then we have learned legs to legs. And third, we have learned arm to leg. So this is cross image correspondence. So are you getting, everyone? Is it easy or difficult? Okay. So all of you can understand this concept? See, many of you already know, because many person already practicing master tongue. But those who are very new, they also, if they can understand, then it is well and fine. Great. easy. Yeah, it is very similar to other system. So we will not treat, okay, same side, opposite side, we will discuss. Shall we go step by step? But I'm sure within 10 days, you will able to treat multiple problems clinically. Fine. Yeah. So if you are new and you can understand, then very good. So let's complete one more thing. So let's proceed now. Fine. Now, we already discussed arm can treat the arm, legs can treat the legs, and arm can treat the legs and legs can treat the arm. Now, so let's talk about the with little more updation. We are talking about the first thing, arm to arm. So let's start arm to arm. Means arm can treat the arm. As per this concept, this is the right arm. And this is the left arm. And as per this concept, we know we have divided it in 5 parts. 1, 2, 3, 4, and 5. Means the shoulder can treat the shoulder, upper arm can treat the upper arm, elbow to elbow, lower arm to lower arm, and palm fingers can treat the palm fingers. So this is concept, this concept. Now Master Tung has applied one more formula everywhere, each and everywhere, that is called reverse image, Sirsashan. We are standing like this, now we are doing Sirsashan, just reverse. So what is reverse? So Master Tung has applied the reverse image everywhere. Let's talk about the reverse image. So this is the arm that we know. In the first position, we have kept the arm like this, and we have divided it in 5 parts. 1, 2, 3, 4, and 5. Now we will do the Sirsashan. We will reverse the arm, and we will put the palm and fingers in the upper side. So this is number 1. Number 2, elbow will be number 3, number 4, and number 5. Now we just have reversed the image. the meaning of this. Now someone is suffering with the shoulder pain. We can put the points in the palm and we can treat the shoulder pain. And Master Tung has been given many points in the palm. They are working immediately for the shoulder pain, like 22.01 and 02. We will learn later on. The 22.01 and 02 are available in the palm and working for shoulder pain very immediately. Even we put the gram seed, chana seed on the 22.02 and 1. It is working. It is creating the relief in the shoulder pain within few minutes. So this is the reverse image. If someone is suffering with a shoulder pain and we are treating the points in the palm and fingers. This is number one. Number two, someone is suffering with pain in the upper arm and we are treating the lower arm. So why we are treating lower arm? We are treating the lower arm. The problem in the upper arm and we are treating the lower arm. This is the reverse imagination. If someone is suffering with the elbow pain and we are treating the other side elbow, because even in the reverse image, the 3 number will remain same. If someone is suffering with the 4 number problem here, means lower arm, then we can treat the other side, upper arm, and finally, someone is having pain in the palm, pain in the fingers, we can put the needles in the shoulder joint and we can treat the palm and finger. So this is the reverse imagination. Let's see once again. So this is the human body. So this is the point number 1, 2, 3, 4, and 5. As per the reverse imagination, this is the point number 1, 2, 3, 4, and 5. So want to treat the shoulder joint. Here, we can put the points in the palm on the other side. So in the master tung, we always put the point on the other side. We never touch the hand which is having problem. In the master tung, we always follow this formula. Do not touch the 6th meridian and always go on the other side. In the same way, if we go in the legs, so this is the one leg. And leg can be divided in 5 parts. 1, that is hip joint. 2, that is thigh. 3, that is knee joint. 4, that is lower leg or calf muscle. And 5, that is foot and toes. So if we go as per the normal image. As per the normal image, the right hip can be treated by the left hip, right thigh can be treated by the left thigh, right knee can be treated by the left knee, right lower legs can be treated by the left lower legs, same, and right foot and toes can be treated by the left foot and toes, means same, same. This is the normal imagination. But when we talk about the reverse, then what will happen? If we are talking about the reverse imagination, so taking the leg here, let's take the leg down. And now make a reverse. So 1, 2, 3, 4, and 5. So as per the reverse imagination, having hip pain, but we are treating in the foot or toes, because we see here the hip pain can be treated by the foot and toes as per the reverse image. Pain of the thigh can be treated by the calf muscles. The thigh can be treated by the lower leg. Knee joint, definitely knee joint will remain same, knee for knee, because it is in the center. Now lower leg can be treated by the upper leg. And finally, the foot and toes can be treated by the hip. So foot toes can be treated by the hip. So this is the reverse imagination. So Master Tung told we are taking one complete arm because arm is too long. Arm is starting from the shoulder joint, then crossing the upper arm, then elbow, then lower arm, then wrist, then palm, then finger. So arm is too long area. So Master Tung told, when you are taking this much long part, means one very long arm, shoulder to fingers, treating the other arm. One very long leg, leg is also very long, starting from hip joint, then thigh, then knee, then lower leg, then ankle joint, then foot, then toes. It is too long part, too large part. So when we are treating one very large part with the other, so when we are treating one full leg, when we are treating one full arm, we are not taking one finger. We are not, right now, we are not going as per the sujog, because in the sujog we are taking fingers, mini part. So we are not going as per mini part, because in Master Tung, slowly, slowly, we will also move to the mini part. That thing also will come. So right now, Master Tung is not talking about the mini part. He is talking about the large. So he told, this is called large Tai Chi. Large Tai Chi imagination. The meaning of large Tai Chi imagination, we are taking a complete arm. We are not taking a half arm. We are not taking only palm. We are not taking only finger. We are not taking only mini correspondence. So that's why it is called large Tai Chi. And in one arm, we are doing the imagination of other arm. In the one leg, we are doing the imagination of the other leg. And when we're talking about the cross in the one arm, we are doing the imagination of complete leg. So don't worry, slowly I will tell you same side, other side. But just remember the formula of master tongue. Do not touch the area having problem. Go to the other side most of the time. But slowly, you will get complete idea where to go. Exactly. So now let's discuss the last part of the large. We cannot tell the last part will be discussed tomorrow, but the last part for today we discuss the cross imagination. The cross imagination as per large Tai Chi. So we are discussing the cross imagination now. What is that? So first, as per the cross imagination, that we know if this is the arm, and we can divide arm in the 5 parts. One, that is shoulder. Two, that is upper arm. Three, elbow. Four is lower arm. Five, that is palm and fingers. Now, if we take one leg, so we are taking leg here, and leg also can be divided in 5 parts. The one is hip, second is thigh, third will be the knee joint, four will be lower leg, and the fifth one will be foot and toes. And in the arm, the first part means shoulder joint or shoulder area. The second part is upper arm. Third part will be elbow. Fourth part will be lower arm. And fifth part will be palm and fingers. So as per the cross imagination, we know that shoulder can treat the hip. Upper arm can treat the thigh. Knee joint, elbow joint can treat the knee joint. Lower arm can treat the lower legs or calf muscles. And finally, palm and fingers can treat the foot and toes. This already discussed as per the cross imagination. And we can see in this image. Now, Master Tung told again this thing in the reverse form. As per the reverse form. So if this is the arm, and we can divide arm into 5 parts. 1, that is shoulder. 2, that is upper arm. 3, that is elbow. 4, low arm. And 5, that will be the palm and fingers. Now, as per the cross imagination, now we are keeping the legs in the reverse way. Now we are keeping the foot in the upper side. So this is the part number 1, that is foot area, foot and toes. This is the part number 2, that is lower leg. Part number 3 will be the knee. Part number 4 will be the thigh. And part number 5 will be the hip joint. So as per the reverse imagination, if suffering with the pain in the shoulder, like shoulder pain, we can treat the foot area or toes area. And we are having so wonderful point. Just putting the point and we can see the immediate results in the shoulder pain. And vice versa. Someone is suffering with the pain in the shoulder and put the point. Someone is suffering with the foot pain, numbness of the toes, and we are treating in the shoulder. Upper arm can treat the lower leg. So calf muscles pain can be treated by this upper arm, calf muscle. Elbow and knee can treat each other. So these things are same, either in the normal imagination or reverse imagination. Then lower arm can treat the thigh area. So we are treating the lower arm for the thigh pain, muscles pain, or any other problem. And if pain in the palms, numbness in the fingers, any other problems in the fingers, we can treat by putting the point in the hip region. So this is the reverse imagination. So as per the reverse imagination, so this is the part number 1. Can treat this is the part this part. Shoulder can treat the foot area. This upper arm can work on the lower leg. Elbow and knee can treat each other. This area or lower arm and thigh can treat each other. And the problem with the palm and finger can be treated by the hip and vice versa. So this is called reverse imagination. So today we have discussed the large Tai Chi. Tomorrow we will continue the discussion of the large Tai Chi. Then we will discuss few protocols. How can we make by using the Tai Chi imagination? So we have to learn multiple Tai Chi, large, medium, small Tai Chi. We have to learn starting from the full arm till the mini correspondence, because these all things has been given by the Master Tung. So we will proceed as per the Master Tung. Now, one final thing today. No, time is over. So time is over. अब हम सिर्फ थोड़ा सा ब्रेक दे रहे हैं 5 मिनट का. उसके बाद हम हिंदी में क्लासेस स्टार्ट करेंगे. तो if you want to join class in Hindi, so take a 5 minute break and come back. We will do the same repetition in Hindi after 5 minutes. अभी wrist, ankle सब आ जाएगा धीरे धीरे. Everything will come slowly, slowly. Just first we are developing the concept. We will not leave anything. So don't worry for that. So you can take 5 minute break and come back for Hindi class. And those who has understood well, they even can leave if they want, because we will do the same repetition. We will not teach anything new in the Hindi.